Hey everybody. Um Sitting here waiting for the movie folks to get here. It feels really good. So decided to wait in my car a little bit and just jam out to some music. But before I listen to some music, I am in this I guess like a messenger group. And there was a thread or a chat of individuals talking about someone knew of someone that is being pressured to get a vaginal rejuvenation surgery by their male partner. And this person is really considering a vaginal rejuvenation surgery. Before you consider a vaginal rejuvenation surgery, I want to talk about, one, what it is, but two, the different options that you're probably going to hear from other doctors as well too, but also really considering the risk as well too, and really understanding really what it is to begin with. Vaginal rejuvenation surgery is different from a pelvic floor surgery. You're going to hear probably, especially if you definitely talk to your gynecologist. I'm not a gynecologist. I am not a health professional, besides a sexual health professional. I'm a sexual health professional. So, vaginal rejuvenation surgery is a plastic surgery for appearances versus a pelvic floor reconstruction surgery often repairs the vaginal walls and different other areas within your vagina to make sure that there are areas intact to prevent prolapse or to repair prolapse as well too. But also it can have a rejuvenating effect as well too for individuals that may receive it. But the pelvic floor reconstruction surgery has a lot of an anatomical nature to it. The whole goal of it is to repair something, versus vaginal rejuvenation is an appearance aspect of a surgery, is a purely cosmetic and plastic surgery based procedure. It is often spearheaded by society's view to police what a vulva should look like and what a vagina should feel like as well. This is different than a labia reduction surgery. This is vaginal rejuvenation that often will give the appearance of being tighter, but it's not necessarily for the pleasure of vulva owners. Vulva owners do not really receive an increased sensation of pleasure after getting vaginal rejuvenation procedures. We know that our erogenous zone and our pleasure zone within the vulva is the clitoris. We know that that is the major space for where pleasure is, but also within the G-spot as well too. This vaginal rejuvenation surgery has nothing to do with those areas of your vulva. Vaginal rejuvenation is for and often spearheaded by partners who are insecure. And I'm not saying that it's always the case, but it's often spearheaded by partners who sometimes are insecure. It is often spearheaded by also individuals that can have an insecurity as well too about what their vulva should be, what they feel is the normal of their vulva as well too. But also this kind of mysticism and misinformation about what a vagina does and how it should feel and how it should operate for their partner. And again, this is totally different than a pelvic floor reconstruction surgery that tends to repair the vaginal walls, and also assist with the vaginal process of what it ought to be for anatomy purposes, to increase vaginal health. Now, a pelvic floor reconstruction can increase pleasure for vulva owners. It can. Primarily because being able to repair the vaginal walls, and being able to repair even a prolapse can support less pain, can allow for more vaginal health, which in return can allow for more pleasure for the vulva owner. Now, this is totally different than a vaginal reconstruction, or not a vaginal reconstruction, a vaginal rejuvenation. A vaginal rejuvenation is only for appearances. It is only a cosmetic way of looking at your vulva and your vagina. I'm not going to knock anyone's decision for choosing it. I believe in body autonomy. But please know that there's also other options for you as well too. That Kegel exercises are amazing for strengthening your vaginal walls. Kegel balls, Benoit balls as well too. They are really great for increasing your vaginal health and strengthening your vaginal walls. Being able, if sex is painful, being able to make sure that you're checking in with your doctor, making sure that you don't have any scar tissue or endometriosis concerns, polycystic ovarian syndrome, or some of the other things that can cause painful sex. And also maybe even utilizing dilators to support some Kegel exercises as well too, to tighten around a dilator. Those may be some things that you can do to strengthen that and make it, because it's a muscle. Your vagina is a muscle. You can tighten it naturally. There are things that can impede on your vaginal walls and being able to tighten it up, such as cancer, such as hormone changes, such as trauma as well too, such as other surgeries, hysterectomy. But there are things that you can also work with your doctor on as well too. You can talk to a pelvic floor doctor. You can there's physical therapists. And I have some physical therapists on my Facebook and on my social medias as well too that specialize in vaginal pelvic floor activities and education and medicine. There are people out there that will also support you as well too. So I do strongly suggest that if you're wanting to do vaginal rejuvenation, only for appearances and only for your partner's sake, that maybe you should consider some other options first. And I'm not knocking the procedure and anyone's ability to even get the procedure. I do believe in body autonomy, but there's some natural options. You have a major risk of infection. You have a major risk of even something happening within, like a nerve damage within your vagina. So just please consider these options in this education before you consider. I want you all to make an informed decision and not based on the shame that sometimes society puts on the vulva. And you deserve to make an informed decision and educated on this before you make something that you're going to find out, especially vaginal rejuvenation, that it really doesn't maybe increase the pleasure like you may think. May increase a feeling of temporary security, temporary feelings of that you are tighter, but it doesn't mean that it's going to last. I think you have to rid some shame of the vulva. Rid some shame on what society puts on the vulva and what it should look like, what it should feel like. And I think a lot of individuals that are penis owners need to have a re-education of what it ought to be. People want to emulate what it should feel like, almost to have a virginal experience. And that is one, very oppressive. It's very, it is very oppressive. I don't even know how to explain it more than that. It's oppressive. And it's based on society standards of what sex should be like in centering the penis in pleasure. But for individuals that are vulva owners getting vaginal rejuvenation, they may not experience any type of increased pleasure and experience from this. So you have to understand, why are you doing this? You need to ask your question, why? Are there other options? And who's it for? Is it for you? Or is it for someone else? Is it informed from shame? And if so, is there ways that we can get beyond that? And myself and some of my colleagues who are sexologists, we can begin having these deep conversations about shame when it comes to our vulva and our vagina. But vaginal rejuvenation, let's really consider that as, it's a plastic surgery. And not saying that I'm not beyond plastic surgery. I'm getting a tummy tuck. I lost all this over 100 pounds. I'm getting a tummy tuck. I'm getting some work done to make sure I get rid of some extra skin and stuff. But even before I have to make this decision for my body, I have to take a step back and make an informed decision of my options. And I want to make sure that you are making an informed decision before you make this, and you realize, wow, this has not necessarily increased my pleasure. So, good morning, you all. I hope this Quickie of the week at least allowed you some education. I am, my movers are about to be here in 20 minutes. So I'm super excited. Moving across the country, and more to come with honesty hour, with the Quickie of the week as well too. So I hope you really got some education and information from this. Bye.